Interesting patient to share. She's 38, she came from New York, and her history is she lost 120 pounds, so a monumental feat to do that. But once that process is done, weight loss patients are often left deflated. So she had sagginess throughout the body, breasts were saggy, asymmetric, huge amount of excess abdominal tissue as well. So the first stage we did was a combination breast lift and extended tummy tuck. You can see she got a great result. Her breasts are up and perky, they look natural. We got rid of all this excess abdominal tissue and got her abdomen nice and flat. Also, look at that dip in the waist, because what we did with her tummy tuck is we extended that around, what's called an extended tummy tuck, almost all the way. That allows us to tighten up all of this area, and then we did a thorough liposuction in the back and waist to dip in the waist. So it's pretty incredible that you can go from all of this heaviness to a thin hourglass shape, and even with some, roundness and fullness in the buttocks. So she was thrilled. 3 months later, she came back for a second stage, and at that point, her, face she wanted to address because she felt she was looking older than her age, and also her arms and thighs were saggy. So we did a combination facelift, neck lift with some facial fat grafting. She had an arm lift and a thigh lift, and we actually did a rhinoplasty at the same time. So we're always using, multiple surgeons in these cases, so we actually got that done in less than 6 hours, which is, quite efficient for that. And got a great change. So it's worth noting just in the face, sort of the way we address this. So in facelift, what we're always doing is what's called a deep plane facelift. And you can see the way we do this. She's on her side and we're looking here. We design this incision so it wraps around the ear. So that ends up being essentially totally hidden. And then what we do is what's called a deep plane facelift, where we lift up the architecture of the face. And we lift the skin, and then as a separate layer, we lift the deep muscular layer. So when we lift the deep muscular layer as a separate plane, essentially, what that allows us to do is to bring the entire face up. And so what we want to do in facelift is reestablish the architecture to where it was when she was younger. And that allows us to get a powerful result, a very natural result. And so her surgery went great, her recovery was perfect, and she requested to do a testimonial when she was finished. And this has got to be 10 days after this big, huge second stage of procedure. And it's kind of fascinating the words that she uses.
It's been very easy. I said it's easy, it's safe, it's a wonderful environment, something you guys do. I don't know if there's really...
So, easy, amazing. That 10 days after this second stage, huge combination procedure, she looks pretty normal. She's got a mask on, but she's had an eyelid surgery and facelift within 10 days. She looks great, she feels great, she's super happy she chose us, and she said it was easy. So can't ask for much more than that. Great case.